HHA Practice Test 2026 Home Health Aide, Full Course Documentation Reporting Guide. Question 1. Documentation should be done at the end of the week, immediately after a task is completed, before the task starts, by the client's family. Immediate documentation ensures accuracy and prevents forgetting details. Question 2. Which is an example of objective information? The client says they feel sick. The client has a temperature of 101 F. The client seems angry. The client likes the soup. Objective information is measurable and observable by the senses. Question 3. Which is an example of subjective information? The client's skin is red. The client ate 50% of breakfast. The client reports a headache. The client's pulse is 72. Subjective information is what the client tells you and cannot be directly measured. Question 4. If an HHA makes an error in a written chart, they should use whiteout. Scribble it out until unreadable. Draw a single line through it, write error, and initial. Discard the whole page. Legal documentation requires a single line through errors to maintain transparency. Question 5. The medical abbreviation NPO means nothing by mouth, normal pulse only, next patient only, needs physical observation. NPO stands for nil per os, meaning the patient should not eat or drink. Question 6. Which of the following must be reported to the supervisor immediately? The client watched a movie. The client's daughter called. The client fell but says they are fine. The client changed their shirt. Any incident, fall, or significant change in status must be reported immediately. Question 7. What is the purpose of the care plan? To keep track of the client's bills. To provide instructions for the client's specific care. To list the HHA's vacation days. To record the HHA's personal phone number. The care plan is a roadmap for the specific needs and goals of the client. Question 8. HIPAA is a federal law that protects an HHA's right to overtime, a client's health information privacy, the hospital's profit, the brand of medical equipment. Health Insurance Portability and Accountability Act ensures patient confidentiality. Question 9. When documenting, an HHA should use pencil, blue or black ink, red ink for emergencies, markers, permanent ink, usually black, is required for medical records. Question 10. QD is a common, though often discouraged, abbreviation for every day, every hour, twice a day, quiet day. QD means daily, though it is on the do not use list in some facilities due to potential errors. Question 11. An incident report should be completed when the client eats all their lunch, the HHA arrives on time, a medication error occurs, the sun is shining. Incidents like medication errors, injuries, or unexpected events require a formal report. Question 12. How should an HHA describe a client's mood in documentation? The client is crazy. The client cried for 10 minutes. The client is being difficult. The client wants attention. Documentation should use factual, descriptive language rather than judgmental terms. Question 13. What does PRN mean? Please respond now. As needed. Pulse rate normal. Patient requires nutrition. PRN stands for pro re nata, meaning as the situation arises or as needed. Question 14. A client's pulse is 110 beats per minute. This is called bradycardia, tachycardia, hypertension, hypoxia. Tachycardia is a heart rate over 100 bpm. Question 15. In military time, 2 p.m. is written as 0200 1200, 1400 2200. 12 plus 2 equals 14, 1400 is 2 p.m. Question 16. Which is the best way to document a client's refusal of care? Ignore it and don't document. Force the client and say they liked it. Document the refusal and notify the supervisor. Ask the neighbor to do it. Clients have the right to refuse care, it must be documented and reported. Question 17. What should an HHA do if they forget to document a task until they get home? Call the client and ask them to write it. Wait until the next shift and backdate it. Call the supervisor and follow the agency's late entry policy. Forget about it. Follow specific agency protocol for late entries to ensure legality. Question 18. The O in SOAP note stands for opinion, objective, order, observation. SOAP stands for subjective, objective, assessment, and plan. Question 19. When reporting to a supervisor, the HHA should be vague and brief, detailed and factual, emotional and loud, silent, clear. Factual reporting is essential for patient safety and care coordination. Question 20. Who is allowed to see a client's medical records? Anyone who asks. Only the client's family. Only members of the care team directly involved with the client. The HHA's friends. Access is limited to those with a professional need to know.